What's going on, everyone? Happy Tuesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Tuesday edition of the Pandemic Update for Tuesday, July 16th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there's a lot of different viruses out there. First one we're going to talk about today is measles. You need to know what's going on with all these viruses, especially COVID. Hey, we're in the middle of a summer surge right now. COVID cases, they're rising in the United States. The pandemic never ended. Maybe you clicked on this video because you or someone you know tested positive right now during this summer surge, and you want to know, how can this be? I thought COVID was over. I didn't know COVID was still in circulation. Well, I'm here to tell you, COVID is still in circulation, and levels are on the rise across the United States right now. We're going to take a look at multiple states today that are seeing increasing COVID cases, hospitalizations, emergency department visits, even trips to the urgent care are on the increase in the United States right now. Want to stay informed with what's going on? Just subscribe to my channel down below. Give this a thumbs up. Hit that share button. More people that give this a thumbs up and a share, the more this channel will grow and the more people we can help keep informed and safe. Leave your comments down below and remember to hit that notification bell. Alright, starting off in Canada today for the first of two times, the first time being for measles. Second contagious case of measles reported in Montreal. Public Health said Monday that a passenger on a July 8th Air Transat flight in Montreal from Rome was infected with the contagious disease. If you want to read all about this, this will be posted on my X. It already was, and I'll make sure I add this to my site, datareport.info. We'll take a look at my site in just a little bit. Moving on to this now. COVID-19 leads to long-term changes in the immune system, study shows. Hey, this is just one of many studies that have been out there that state COVID can damage the immune system. And before you start typing down below, it was the vax. No, this started occurring long before the vaccine started becoming a thing. This started back in 2020 when no one was vaccinated, when people were being infected by COVID before the vaccine. Not breakthrough cases, not during the vaccine, before the vaccine. And this is something that still happens to this day. Alright, moving on. People with long COVID, 3 times more likely to give up work. Study highlights the total of ongoing COVID-19 symptoms on the workforce. Yet again, another study that shows something that we have known about that just emphasizes it more. People with long COVID get impacted in many different ways. Some people, it's really minor. Other people, they cannot function with their day-to-day activities. It's nearly impossible. They have their ears ringing. They have breathing difficulty. They're constantly tired. They do a task as simple as washing the dishes, and then guess what? They have to go lay down and take a nap because they are already exhausted and worked through their energy. Many people have to give up work because of this. And in some cases, because they have to give up work because it's so hard to get disability for long COVID, guess what happens next? They then have to sell their house and maybe move in with a relative or, something like that. So, yes, this is a real problem. We need to address this. We just completely ignore this issue, and it is totally ridiculous. We really need to take long COVID seriously. Something else we need to take seriously, and I'll have a personal note about this in just a moment. Gastrointestinal issues, a common but overlooked symptom of COVID. This is very true. I've actually had this happen. I had to go to a GI specialist back in January. People who have been subscribed to my channel for a long time might remember I went to a GI specialist back in January, and the GI specialist said, "Oh no, COVID doesn't cause GI issues." Here you go. Gastrointestinal issues, a common but overlooked symptom. Study says COVID could cause long-term gastrointestinal issues. 50% of patients see these symptoms. Infection could disrupt connection between gut and brain. Yet again, another way COVID can impact the brain. It is just totally insane. And there's a lot of people that report GI issues post-COVID and during infection as well. So please don't discount GI issues. See, one of the things that happens that I tend to find happen, some of these specialists, I'm not going to name or say one, but sometimes they don't always keep up with the latest studies from COVID. I think this may be a problem that should be addressed in the medical community. There's a lot of new studies that continuously keep coming out with COVID. I think people need to be required to keep up to date with what is going on. That's just my opinion. No offense to anyone in medical opinion. It's just my opinion that maybe there should be some sort of a requirement. All right, moving on to this. Tour de France strikes yet again. Chris Harper, fourth rider out of Tour de France due to COVID. I will get this one onto my site as well. And quite frankly, there have been many. And there was a list that was compiled by Cycling News. I simply just added that list in here. Maybe at some point I will go back and add all those names, but I will make sure that we get Chris Harper added into there and into the COVID positive archive as well. Moving on. Statement from Assistant Secretary for Public Affairs Jeff Nesbitt on HHS Secretary Becerra testing positive for COVID-19. That's right, another U.S. official has tested positive for COVID. And it says this morning, U.S. Health and Humane Services Secretary Xavier Becerra tested positive for COVID after experiencing mild symptoms. He is fully vaccinated and 3 times boosted. He will continue to work remotely. The Secretary remains engaged with duties of his office from isolation and is eager to return to in-person meetings as quickly as possible. So he's going to work right through his case, which means long COVID is a risk. And I should also note, I checked my website, don't have that name listed, and I will have to check and see if I've tweeted this name in the past. I seem to recall a past case, but not seeing it so far. There's a couple different places I can check. We'll see if he has had a previous case, and if he did, I'll get back to you on that, either into tomorrow's update, or I'll just tweet it out on X. Moving on now, taking a look at the National Allergy Map, 56% of the country is in low to medium status, and we do note there is quite a bit of green today. There's also some yellow, but no oranges and no red. That is a good thing. Air qualities. Air qualities are not a good thing, for several places still are dealing with air quality issues. And take a look at the East Coast. Oranges, yellows, yes, up and down the East Coast, not a good thing. And we can see here, Salt Lake City out in the west, Boise, Idaho, a lot of places in the west are not doing well either and are dealing with bad air qualities, something that we don't like to see. We like to see these greens, and unfortunately, there is not a lot of greens. Chicago, you got whacked with severe thunderstorms yesterday, and unfortunately, your air quality yet again today is not perfect. Heat-related illnesses, they're also not perfect. They're increasing in the west big time. They're increasing in the mid-Atlantic. They're also increasing in the northeast. I suspect next week when we see this update, we'll see some more shades of brown for Pennsylvania. There's been quite a few heat-related illness calls over the past couple of days in Philadelphia. We'll take a look at that in just a moment. Want to follow me on my other platform on X? Climate Data Report, that's the way to do that. Also, my other YouTube channel is Climate Data Report. We haven't posted a video there. I'm going to get something out on that relatively soon. All right, as noted, we'll talk about Philadelphia now. There were a lot of EMS calls yesterday. 870 to be exact in Philadelphia yesterday for Monday, July 15th. That is a really high and unacceptable number. And here we are taking a look now at Montgomery County, Pennsylvania. Not as busy as late this morning. At around 11:30 a.m., I noted 22 active calls in Montgomery County. It was starting to drop. Now it's starting to go back up again. It was down below 10 just a few moments ago. Now it's back up above 12 once again. Let's take a look at Chester County. We can see, yes, multiple heat-related illness calls. Exposure to heat and cold. Exposure to heat and cold. Respiratory. Sick person. There were a ton of sick person calls earlier. And drum roll, please. Speaking of that, let's continue on with Pennsylvania for a moment. Let's actually take this to full screen for just a second. And we can see here for COVID and wastewater in Pennsylvania, as I thought might be the case this week. It's starting to rise in some places in Pennsylvania. Specifically, Southeast Pennsylvania is seeing the biggest rise. Lehigh Valley is also seeing a rise, and Erie is seeing a rise. But when we take a look at Southeast Pennsylvania, we do note Chester County. Look what it says here, red. And let's take this back to the smaller view. Red means large increase. So Chester County, Pennsylvania is now seeing a large increase. Abington, Montgomery County is seeing an increase. Lansdale up in Montgomery County is also seeing an increase right now. And when we go up to Lehigh County, that is seeing an increase. And then we also do see an increase up in Erie County, Pennsylvania. And take a look at this. State College, Center County, Pennsylvania, you're actually seeing a decrease. We'll have to see if that continues. You just had two major events that went on up there, and the rest of the state is not doing bad, but I suspect the orange and red, as we finish out this month, or go into the second half of this month, and into August, will probably increase across the rest of the state, like normally happens pretty much almost every summer in my state. Taking a look at Walgreens, the national positivity rate is 39.2%. That is down 0.4%. From 39.6% because testing had a huge increase, 6,767 tests, and the prior week was 5,109 tests. Now, I'm saying prior week. We'll have to see here. There's something that got tweeted out yesterday, and I think I'm going to be doing some investigating about Walgreens and how it actually works, something that I was not aware of. More on that in another video. Taking a look at Kansas. Kansas, 41.2% positivity rate. That's up by 20%. That's up by 21.2% from 20%. 51 tests versus 25. Yeah, that's a legitimate rise. Your cases are rising at this time. Texas at this time, 43.7% positivity rate this week. The prior week was 41.5%. Difference of up 2.2%. And you're doing a good amount of testing. 1,331 with versus 1,100 the previous week. Kentucky, what's going on with you? Kentucky testing 70 versus 44 tests. That resulted in positivity rate dropping 30% versus 40.9%. That's down by 10.9%. Let's go out to Idaho. What's going on there? Not a lot of testing there, but your positivity rate did drop. And I do notice here, I'm going to zoom this in. Look how you do a lot of up and down movements. There's some states that do that at Walgreens simply because of the number of testing. 30.8% positivity rate versus 53.8. That's a difference of down 23.1%. And we will end that. We will end Walgreens on that note. Let's take a look at the nationwide wastewater level on wastewater scan. And we do note COVID, it's high at this time. Take a look at this. It's been going up somewhere else where it's high. Well, now our second look at Canada. Yep, Canada, the viral activity level of COVID is now listed as high, and flu A is indicated at moderate at this time. No detection of flu B, and RSV is low at this time. So no flu B. That's the good news, but the bad news is COVID viral activity level is now high up in Canada. Now let's take a look at what's going on in New Jersey today. And New Jersey has 322 hospitalizations. This number does continue to rise at this time, but remember, it's saying 70 out of 70 hospitals reporting, and all these numbers from all time reported on here constantly keep changing day to day. I don't know what's going on with that. Is it a computer issue? Something's going on in New Jersey. On a ventilator, 18. In the ICU, 42. Discharges, 45 at this time. New York State had 1,219 new cases added, and the hospitalizations in New York State, they did continue to rise. They went back above 1,000 again, 1,072 with 85 people in the ICU. And let's take a look at New York City, and we'll see that New York City at this time has 524 people in the hospital, 41 people in the ICU, and Western New York is also seeing a rather large increase at this time. Wow, check this out. So they ended last week with 23 people hospitalized, 1 in the ICU. That went up to 32 and 4 people in the ICU. And also we'll take a look at the capital region as well, and take a look at this. The capital region is also rising at this time. 55 people in the hospital, 6 in the ICU. So all across the state of New York, for the most of the state, there's a couple regions not rising, but for the most part, New York State is still rising at this time. All right, let's take a look at Virginia. That's right, we have the weekly update out of Virginia, and we want to take a look at some counts here. We want to take a look at emergency department visits and urgent care visits. Last week, they had, we don't want percentages, we actually want the total counts. And here we go. Here's the number of emergency department and urgent care visits with diagnosed COVID-19 in Virginia for the past 3 months. And we can see last week's update, it was over 2015. This week's update, hell, it went up even higher. It's 2,372. And COVID-like illness, wow, 6,145. And reminder, this is in the summertime. That's a high level for the summertime months. That's not something I like to see whatsoever. Let's take a look at what's going on with wastewater surveillance in Virginia, if we can. It may not load. Sometimes these dashboards, as you know, sometimes they do give us problems. And we do see here oranges in a lot of places. That's plateaus. Gray is no detection. We do see here that it says near Blacksburg is seeing an increase at this time for COVID. But take a look. This is going back to June 23rd. This is not updated, so I don't know why we're even looking at this. Not good. But what we did see is emergency department visits and urgent care visits, and that is a really important metric. Can we click on cases? Let's find out here and see what happens when we click on cases. Hopefully we got an update out of this metric, and we can see here, looks like cases by date of illness, 3,617 as of July 13th. So yes, there's quite a few of them, and then if we go back prior to that, it's a big increase. Before, it was 2,860, so it did go upward. Alrighty, folks, that does it for today's pandemic update. You can follow me on X at COVID Data Report. You can also follow me, I believe it's at Data Report over there on Blue Sky. COVID Data Report also over on Counter Social. And of course, remember, if you're looking for something, you want to find out if someone has had COVID or something, you can go to my website, Data Report. We have COVID studies. Maybe you want to do some research before you're going to visit a specialist. You're compiling your notes. You want to have your case made that, hey, COVID caused me to have this problem, and you want to present a study or something. You can go find some of those studies over on my website. Now, I don't have every single study that was ever posted, but hey, it's a constantly growing archive. It's the same thing with COVID positives. No, I don't have every positive of famous people from the beginning of the pandemic, but who knows? I keep adding them, so it's an ever-growing list. You can see past COVID outbreaks. You can learn about H5N1. You can learn about chronic wasting disease, Mpox, measles, all kinds of stuff. It's a big source of information. Datareport.info. That is my website. Alrighty, folks, that does it for today's pandemic update. We'll have another update tomorrow. I'm sure there'll be a lot of news, probably some more positives, and who knows what else will pop up. If you like this video, give it a thumbs up. Want to see more content like this? Subscribe to my channel down below. Share this with anyone you know. Remember to give this a thumbs up. Let's try for 200 like button hits today. And remember, hit that notification bell. Leave your comments down below. Do you know someone who has COVID right now? Do you have long COVID? Let me know down below. I would like to read about that. Thanks for watching, and I will see you all again next time. Have a fantastic Tuesday evening, and if you're in an area where it's really hot, please stay cool and drink plenty of water. Thanks for watching.